As the nation marks the third anniversary of the first confirmed case of COVID-19, something else has been spreading since the early days of the pandemic. However, it's not another virus, it's false information.
We spoke with local health professionals on the difficulties of combating the spread of misinformation. Here's KQ2's Nick Ingram with the story.
Since the beginning of the pandemic, rumors and misinformation have spread across the country. Health officials have not only had to battle COVID-19, but also misinformation and disinformation surrounding the virus and the vaccines.
Anytime you see that disinformation, misinformation, and a lot of it's done by bots and social media. So as soon as we see it, we know we already have an uphill battle because we're already behind the eight ball, if you will.
Corey Sloan, the CEO of Viking Emergency Preparedness Consultants, is contracted with the Tri-County Health Department as their public health emergency planner. The health department recently posted information regarding circulatory system deaths in an effort to show the importance of finding a credible source.
We're trying to provide the contextual perspective for the public where they can make their decisions, individual decisions along with their clinicians, so they can be able to make the best choice for their health care.
Sloan says that no vaccines are perfect, but the cases of adverse events are low.
No vaccine is 100% risk-free. No vaccine is going to prevent 100% of all deaths. There will be adverse events, and there will be side effects. The question becomes the risk versus benefit. Is the benefit of receiving the vaccine better than the risk of contracting the COVID-19 infection? Which one's the higher risk? And that's a decision that you and your clinician will have to make.
After Damar Hamlin went into cardiac arrest, we asked a Mosaic physician on her opinion regarding the rumors that this event was caused by the vaccine.
I don't think that this had anything to do with what happened in the NFL, although I'm not privy to his information. But he was playing the first 6-7 minutes, and if he was having myocarditis, he would be profoundly short of breath, having chest pain. Somebody else would have known it.
Sloan says even a system like the Vaccine Adverse Event Reporting System, or VAERS, is susceptible to misleading information.
If you go on their website and you start looking at it, you're going to see a lot of information about adverse events for a whole host of things. But you need to read the small print because it's a publicly inputted database. There's nothing that vets it, nothing that says it's accurate and verifiable. It's just in there.
Sloan says the best way to confirm what you see online is to trust, then verify the sources.
Trust but verify. Okay, trust but verify. If it sounds too good to be true, it probably is. I read this online. Okay, I'm going to go talk to my healthcare provider about it. Or I may reach out to my public health department and talk to them, somebody that's involved in epidemiology or infectious disease or vaccine preventable diseases, and talk to them about this information, who might be able to provide them other sources that say, okay, here's where you need to go to get this information and be able to make your choice, your decision on what you want to do on believing or not believing what you just read.
Reporting, Nick Ingram, KQ2 News.
The CDC has developed a section on their website on how to address COVID-19 vaccine misinformation. The link will be available on this story on our website, kq2.com.